Hello and welcome to this week's staff brief. I'm Paul Robinson, I'm the Chief Executive here at Sherwood. Today I've got with me Carolyn Harris, the Learning and Development Department Leader, Rebecca Ford, Recruitment Manager, and Carolyn and Rebecca will be talking to us about National Apprenticeship Week. I've also got Suman Dove, People, Equality, Diversity, Inclusion Support Officer, and so will be talking to us about Race Equality Week. And before I move on to some general updates, I'm going to introduce Amy Gouldstone, our People Wellbeing Lead, who's going to give us an update on Turkey and Syria and the terrible disaster that's happened there. So, Amy, over to you.
Thank you, Paul. Yeah, I'm sure many people have seen on the news about the natural disaster in Turkey with the earthquake. Really big numbers of loss, and we really recognise that colleagues may have family, friends that are over there and may be affected. So I just wanted to come on to say, obviously from a wellbeing perspective, and looking after you, you can have a conversation with your line manager if you need time to take out to speak to family and friends. If you want to chat to someone 24/7, of course, we've got our employee assistance programme phone number, which Jess will pop in the chat now, and our wellbeing email address if need be. Also, our chaplaincy team have been fabulous. They are there ready for you in the Kingsmill Faith Centre. I've got the words right. Faith Centre at Kingsmill. They're available on the phone as well, so through switchboard 24/7 and call if need be. Newark Chapel is also open 24/7, so you can go in there if you need a little bit of space. And Mansfield, the Pilgrim Centre, again, if you go through switchboard, contact chaplaincy to get the code if you need to get in the code in the room there out of sort of general office hours. That is open in the day, but just outside of that. So chaplaincy team are there to support you, obviously, if you need to have that time out. And I recognise this affects everybody, including those obviously that have got family friends out there, but it's hard to see in the news as well. So don't be afraid to reach out if you need that support. So I just wanted to come on really to say that. We're still waiting on sort of the national response and how obviously there'll definitely be some natural disaster campaign and support. And there'll be a phone line, I imagine, shortly, but we're still waiting on all of that. So there'll be bits and bobs coming out in the bulletins and communications emails on there. But yeah, just wanted to really recognise that we know this will affect colleagues. So thank you, and thank you for having me last minute as well.
Yeah, thanks, Amy. Really important that we remind people who may be affected by this awful disaster that there is help and support available, and clearly there'll be more formal rollouts of initiatives and support that will be in place in the coming days and weeks, but really use the support that's available if you feel affected by the events in Turkey and in Syria. Okay, thank you for popping in, Amy. I know that you're going to hang around if there are any questions. Please log any questions for Amy or for anyone on today's brief in the chat as we go. So before I turn to Carolyn and Rebecca, I've got, by way of update, I've got 3 reminders for everyone. A reminder to use your annual leave by the end of March, a reminder not to park in public and patient car parks, and a further reminder to access your flu and COVID vaccination. So if we go through each one of those in turn. So as we know, taking our annual leave is vital, ensuring that we have enough rest in order to recuperate and support physical and mental well-being, especially important given the efforts that colleagues have been supporting the trust through in January and over the Christmas period. And as we approach the end of the leave year, which is the 31st of March, just want to make sure everyone's reminded to look to begin to take the periods of annual leave that they've got outstanding, so they've got adequate rest, and that remaining leave to be taken by, as I said, the 31st of March. All requests that you make we consider on an individual basis, and any outstanding leave that you have on the 31st of March will only be carried forward into the next year in exceptional circumstances. If you've got any queries regarding leave, then please contact the HR operational team on extension 4633. So that's annual leave. And then I also mentioned car parking. So it's a plea to use appropriate car parks, because we're aware there are cases of colleagues using the patient and public car parks whilst they're here on site. Please be mindful and find the appropriate car parks when you're here. I know that not being able to find a car parking space is frustrating, but it's equally frustrating for patients, and if they can't find a car parking space, and it impacts on patients' experience. And we're beginning to hear a number of concerns from patients, and I have received personally a couple of complaints from our own staff members who are also observing this and suggesting that colleagues should be discouraged from using the patient and public car parks. We know that there are times when staff car parks are busy, but it's imperative that we leave the patient spaces available for their use only. So if you've got any further questions or queries on car parking, then please contact. I'll give you an email address, and hopefully Jess can pop this in the chat: sfh-tr.carparking@nhs.net. Okay, so finally, flu and COVID vaccinations. So we continue to encourage colleagues to receive both of the vaccinations, and the vaccination team can attend your ward and department on the dates that Jess will show shortly. In order to access that and get them to come out, then please call the occupational health team on 3780. Additionally, the vaccination hub is open daily for walk-ins for both vaccinations. Just bring your ID badge with you. So far, 63% of colleagues have had the flu vaccination. Thank you to each and every one of you that's done so. And just a reminder that our divisional competition is still on. Medicine division remains in the lead with nearly 60% uptake. The winning division will receive a glittering trophy and £500 worth of gift vouchers, and that final count will take place at the end of February. So they've got until the end of this month, plenty of time to get vaccinated and be part of the winning division. And then lastly, on this, then this week is the last week that COVID boosters, what's known as the autumn COVID booster, is available. So you won't be able to access the boosters from the end of this week, but you're still, if you haven't received your first and your second vaccinations, you can still access those at the vaccination hub this week and for the remainder of February and into March. Okay, so I'll pause there. Please add any questions or comments into the Q&A. And with that, I'll look to Carolyn and Rebecca to talk to us about National Apprentice Week. So over to you. Thank you.
Thanks, Paul. So thanks for having us both here. Apprenticeship Week is this week, annual national week of sort of celebration and drawing awareness to apprenticeships that are available. So we thought we'd just talk a little bit about them. Some of the apprenticeships that maybe aren't as well known, for example, and you'll see lots of comms. We've got some posters that we're putting around and different things happening throughout the week. There'll also be some more information on the bulletin. So we're just going to go through a few of these apprenticeships that are available. Now, there's lots of different apprenticeships, so it doesn't matter what your job role is, whether it's clinical or non-clinical, there'll be something somewhere that will be suitable for your job role. Just for an example, we've got them, it starts off at entry level, level 2. So, for example, customer service, accountant, finance assistant, recruitment resourcer, right up to level 7. So that's master's level. Senior people professional, senior leader, and accountancy taxation professional, and all in between we've got various different ones that apply to lots and lots of different job roles. And I think sometimes people have not really realised, or we've not shouted enough about what sort of apprenticeships are available for staff, and these are available for existing and external recruited staff as well. There's more information on the intranet, and I'll show you how to find that a little bit later on. So just got a few, we get a lot of questions about apprenticeships. So people are asking, well, who can do an apprenticeship? They're available for both existing staff and new staff. There's no age limits. Sometimes we get questions saying, well, am I too old? Are apprenticeships just for school leavers? But there's no age limits at all. How are apprenticeships funded? The trust plays into an apprenticeship levy. and with that pot of money, we can draw down that pot of money to pay for the course costs of apprenticeships. There's certain things it can't be used for. It can't be used to, for example, backfill a role if somebody's having their study days or something like that, but it can pay for the course costs. So there's no cost to the individual. Can you do anything, any standard or any apprenticeship that you choose? Unfortunately, it needs to be related to the job role that you're in, because you need to be working in that environment to get that evidence to actually complete that apprenticeship. So, for example, if you're working in an administration role, you wouldn't be able to access something like the healthcare support worker. It's got to be something that you're working in at the moment. And that is one of the requirements of the funding rules. You also need to be in a substantive post or a contract that is at least as long as that apprenticeship is for. And that is, again, is one of the funding rules about it that we have to adhere to. If you're an existing member of staff, sometimes we get people concerned that they'll go on to an apprenticeship wage. But if you're an existing member of staff, you will stay on your current, at least your current wage. And if you're recruiting externally for an apprentice, I've got the current rates on the screen now, and we've got some more information on our intranet site. They will adjust in April, because it will increase in April. Another question we get asked a lot is, will you be given study time? And everybody that's on an apprenticeship needs to be given what we call off the job training time, and that is so much time per week to dedicate towards your apprenticeship, and there's various ways that can be used, and I'll go into that in a bit more detail in a second. If you're contracted for over 30 and over hours per week, you need to be given 6 hours of off the job training time. If you're contracted for less than 30 hours per week, it's 20% of whatever you're contracted to, and that is an agreement between your line manager and you and the training provider. And you need to get that to be able to qualify for the funding. These are just a few of the things. Some people are a little bit confused about what off the training can be, and think that it means that the staff member or yourself is in a college or in a study day all the time. There are study days involved with apprenticeships, but there's a lot of other things that off the job training time could be. It could be shadowing another department, having a discussion with a different member of staff, webinars, online work, projects, simulation, anything really, as long as it applies to that particular apprenticeship standard that learner is doing, and also that there's a degree of new learning. So that it's very flexible. It's actually more flexible than people think. So it's not just, doesn't mean that they'll be sat in a classroom and they won't be about. They might still be in their on site or in their particular office or ward environment, but during that time they'll be doing additional things to develop themselves during this time. So it's difficult to give you lots of information. So we've got some intranet pages, and we've actually got a new process on there. So if you're wanting to do an apprenticeship and you're interested in for yourself as a staff member, you can just have a look on the intranet site. You need to talk to your line manager first, because you need your line manager's support to be able to access apprenticeships. So that's your first step. But if you just want some basic information, what apprenticeships are available, what might be suitable to your particular job role, then feel free to contact Learning and Development on the email address there. Also, have a look on our intranet site. If you're a line manager and you're interested in having an apprenticeship, apprentice in your department. We've got an event. You want to explain a little bit more about that?
Yeah, thanks, Carolyn. Hi, everyone. So on Thursday afternoon, there will be a Microsoft Teams meeting with myself and Carolyn to discuss apprenticeships. So if any managers are listening to this and they're interested in having an apprentice on their team, I think a booking form is going to be added to the chat shortly. So if you want to register your interest on there, or you can email the SFH apprenticeships email address and we'll be able to book you on. And in that session, we'll be answering all the questions that any managers have got around what Carolyn's just been speaking about, the off-the-job training, what examples we can give as to what that consists of, and any other questions that managers might have that might be making them reluctant to have an apprentice within the team. Because last week we had a commitment from the trust that from June onwards we will have at least 20 external apprenticeships advertised, which is really fantastic news. It's something, as the largest organisation in the area, we need to get to. And with the education providers that are in our local area, we really want to build them relationships and help support people get into work within the NHS. So this will be a really good workshop where you can ask any questions that you may have. We can go through the apprenticeship processes and just anything that you want to ask, and any misconceptions that you may have around what an apprenticeship involves. We'll be more than happy to answer any questions.
And I think it's just really important to be able to develop. One of our objectives is obviously to develop the staff within SFH, but also look to the future and draw people in to be our future workforce. And apprenticeships can be an ideal solution to both of those. So it's really, really important. Okay, thank you, Paul.
Thank you. Thanks. You just stole my thunder right at the end there, Councillor. I was going to make two comments, which is it's really, really important that we expand and grow the number of apprenticeships that are on offer in order to develop our people who are already with us and contributing. But it's also really important and really part of our objectives to look out into the local community and provide employment and development opportunities for people to come and join us and become that workforce of the future. So you've hit the nail on the head with both of those things. And the range of apprenticeships on offer is increasing as well. So we're growing the offer, we're growing the opportunity for colleagues, and it's open to everyone, as you said. There's no barrier in terms of role or age here. Everyone can access it, and really consider it really closely. Look on the intranet for more information. I wonder, Carolyn and Rebecca, is there anything that we can do to get people who've already accessed apprenticeships in this way to provide their story, so that people get a view of how they've accessed it, what that off-the-job training's felt like for them, and what support's on offer. I wonder if we can do that at a future team brief or by another means.
Yeah, we've certainly we've got some sort of blogs and accounts from different learners that have been on apprenticeships in the past, and also the people that are on apprenticeships now. So we could certainly put that information together and share that and see if we can get people to actually come and talk to us.
Yeah. Also, just very quickly, if we've got any apprenticeships listening right now, there is a photo opportunity at 4:30 today near the community hub. So if you'd like to come along and even bring your manager and just have a picture, it will be put across social media to support the National Apprenticeship Week. But yeah, it'd be really fantastic if you could come down and have your picture taken.
Yeah, come down. It's I'll be there for a photo opportunity, never miss. So it'd be great to see everyone there. I've got a comment in the chat. Fantastic to see us embracing apprenticeships. They are the workforce of the future. So just underlining exactly that we're aiming to provide on this. So thank you very much for that input. Please make access to the intranet just to get more information, and or contact Carolyn and Rebecca and the team for more information if you'd like to take that forward. Brilliant, thank you. Okay, let's move on to Race Equality Week, and Suman, you're going to talk to us about that, and I think a little bit range of what support is on offer. So over to you.
Thank you, Paul. Yes, so my name is Suman Dove. I'm the Ethnic Minority Staff Chair for Sherwood Forest Hospitals. Thank you for inviting me to our staff brief. So just to give you a bit of an insight into Race Equality Week, which has been happening from 6th of February to the 12th of February, all this week. And Sherwood Forest Hospitals is proud to be participating in the Race Equality Week. So what is Race Equality Week? It's an annual UK-wide movement uniting thousands of organisations and individuals to address the barriers to face equality in workplace. The understanding and the awareness across any organisation is important. More than 2,000 organisations took part in the first Race Equality Week in February 2021. And then in 2022, we engaged 3,500 organisations, which is amazing. Race Equality Week is a UK-wide initiative which was launched by a community interest company in 2021 to turn words into meaningful action. Because event of 2020, which heightened the country's collective consciousness of racism, inequality and injustice experienced by ethnically diverse communities, in this period of 2020, we also saw the COVID-19 pandemic and also added in additional information, the murder of George Floyd. So far, this is an introduction, a background of information for Race Equality Week. So this year's theme, it's everyone's business, was selected by the Race Equality Matters community. There is a strong belief that theme would have a meaningful impact in tackling race equality. The drive to achieve race equality must come from everyone. So I'll just emphasise that it comes from everyone. If not, it can be a lonely battle. If we can improve the majority, if not everyone in the organisation across the UK, we will see much needed shifts in beliefs, cultures, behaviours and positive outcomes for race equality. At Sherwood Forest Hospitals, we join thousands of people by participating in the Race Equality Week, taking meaningful action towards the tackling barriers to race equality. In our Sherwood Forest Communication Bulletin on the 2nd of February, on the article for the Race Equality Week, please join on the link provided a 5-day challenge and complete an activity session. It sounds fantastic having the time just to have that 5 minutes to complete, and this was built by the Race Equality Matters community. There are different activities for all colleagues to engage with each day of the Race Equality Week. They include videos, articles and activities to help colleagues to reflect and, more importantly, take action to drive race equality. So this is why the 2023 Race Equality theme, it's everyone's business and action drives change. So obviously with that is the most important key this week is action drives change. Race Equality Week has potential to be game changing in the way it combines conscious allyship with strong peer network. Race Equality Week is positive force for action. Information has also been put onto the screensavers. So by this and also the ethnic minority staff work lead for the organisation, we are here to help and support, and everyone has a place of being valued and belonging, and it's been great to be part of today to share that information with you. And if anybody else wants any more information, can contact us on our ethnic minority and obviously me direct. So my email is sfh-tr.em.support@nhs.net, and also hopefully it'll be in the chat as well.
Thank you very much for that. I think it's I'm so proud that we're able to support Race Equality Week. It's so you know, it's so important that we understand the barriers that you talked about and the injustice, and I love the it's everyone's business slogan, and it reminded, when you said that, it reminded me that over Christmas I read a book by Michael Holding. Sue, you know about me and cricket, but he's written a book called Why We Kneel and How We Rise, and he talks about it's not enough to be non-racist, we have to be anti-racist. We have to call it out, and we have to model those behaviours, and everyone seeking out and understanding injustice and fighting against it. So, you know, it was something that resonated with me as soon as you said it's everyone's business. It reminded me of that book. And if anyone is curious about that book, it's not just a book about sport. It's a book about anti-racism. So it's a fabulous book, really thought-provoking. So I don't know if Suman, if you've read that, but I can bring it in and let you have a look at it if you think it might be useful.
Yes, please.
Pardon?
Yes, please.
Yeah, I'll bring it in. Yeah. So it's Race Equality Week this week running. So how will we sort of get to know what's happening and how we can get involved?
Yes, so hopefully it's in our staff bulletin. So there's some information you can share from there, and obviously communication's been fantastic, sharing the information across our organisation as well. And hopefully I've just started my secondment today, so I'm just finding my feet. So I'm just trying to capture all the information as well from this week. So hopefully I'll be able to share that with colleagues as well.
Brilliant. Good luck in your secondment. I'm sure you'll be fantastic.
Thank you.
I can't see any questions that have come in for any of our presenters. There is a comment that I'll make in a short while, but please post any questions that you've got in the chat. The comment that we've had came from Gina Robinson, who's part of our IG team. She's asked for the opportunity to come onto Team Brief to talk about the wonderful world of information governance. But I think the point to make here is if anyone wants to come and contribute to Staff Brief, if you've got something that you'd like to share, to celebrate, to make people more broadly aware of something, then please contact Jess Baxter in our comms team, and we'll get you on, and you can join the party. You know, Suman, you really enjoy coming on here, so much so you can't eat breakfast because you're so nervous before you come on. I'm sure that you know, we'll get to the stage of at least having a bit of toast before soon.
No comment.
Enjoy your lunch anyway. Okay, well, I'll draw us to a close if that's okay. I can't see any questions coming in the chat. If you've got any contributions for Team Brief, as I said, contact Jess. With that, I'll thank Amy, Carolyn, Rebecca and Suman for joining us today. Thanks for all your input. If you just a reminder, if you are affected by the events in Turkey and Syria, please reach out for that support that Amy mentioned earlier. Thanks to those that presented. Thanks to Jess Baxter in the background, who makes all this does a technical wizardry and makes all this happen. So thanks for doing that each week, Jess. Thank you. And with that, I'll draw us a close. Thanks for everyone for joining us, and I'll see you again next week. Have a good week.